This is Hearty Brion from BSM1D, and today we're going to talk about range of motion. I'm going to give some set of examples of range of motion for you to know what it is like. Why do we do range of motion? So we do the range of motion in order for us to detect the possible pain that the patients must be feeling, and also to locate where is the pain. And as a nurse, we must know these types of movements in order for us to know what the next move is. So by these movements, we will know how freely our patients move on that particular joint. So it is really important to know this range of motions. So without further ado, let's get into the examples. So keep on watching.
Here, what I'm doing is what we call the flexion and extension of the upper arm. Flexion means moving together the particular joints, while extension means joints are moved far from each other. Here, this is the abduction and adduction. Abduction is movement away from the medial, and adduction is movement toward the medial plane. Now this is the outward and inward rotation. In performing this, we must make sure of the 90-degree angle arm from the body. Okay, so now this is the same of what we performed earlier, which is the flexion and extension. But this exercise is now for the elbow. Next, here is the supination and pronation. In pronation, the palm is down, while on the supination, the palm faces up. You can see it there. Okay, next is the lateral and the medial rotation. So we have many rotations, but this lateral goes to the side and medial goes to the middle side. Next movement is what we call circumduction. It occurs on free movable joints such as this, our shoulders. Okay, now let us go with our wrist. We have the flexion and extension that I already mentioned earlier. But now we will add the hyperextension. Hyperextension is where we move the joint beyond its normal bend. Here is the radial flexion and unreflection. Radial flexion is where we bend the wrist to the thumb or our radial side. Unreflection is where we put it back on its place. You can see I changed its side, but it is still the same. Now here we are performing the abduction and adduction in our thumb, as well as the flexion and extension. Now, when we put the thumb and the small finger together, it is called opposition. Okay, so here I will be doing the abduction and adduction on all the fingers that is left. What I'm performing here is the flexion and extension of the fingers. Now let us go with the head movement or exercise. What I'm doing here is the extension and flexion of the head. So we can really see that flexion and extension are two very common movements. Now here, let's go with our legs. So flexion and extension of our legs. flexion, extension, flexion, extension. Okay, let us go with the abduction and adduction. So remember always that abduction is away and adduction is towards. Abduction, adduction. Okay, now here we are doing also the flexion and extension, but this one is for our knee. Now what we are performing is the inward and outward rotation. As I've said earlier, we have other rotations. Inward rotation is toward the medial part, while the outward rotation is on the lateral side. Okay, now let us go with our last part, which is our ankle. Here we are performing the plantar reflection and dorsal flexion. Dorsal means back, so we are going on that side, and plantar is our sole, so we are going on that side. We also have here the inward and outward rotation, but we also call this eversion and inversion. Eversion is making our plantar face laterally, while inversion makes the plantar face medially. For our last part, this is the abduction and adduction of our fingers or digits in our feet. You can see what I am doing there. And also, we will do the flexion and extension of the fingers of the foot.